Hi, my name is Liz Cornell. I'm here in North Central Florida, and I'm here to just talk about a few special pressure points and sore spots, specifically targeting dressage horses that you may massage. So I've been a dressage rider for 30 years and do some training, and this is Aria, and he's 13, and we're working on 4th Pre-St. George right now, and he's a little bit of our demo horse today. So I'd like to point out a couple of things for you when you go to work on dressage horses specifically. I'd like to start with the TMJ. The TMJ, obviously you've learned a lot about it, but certainly this is a very important area because honestly the tongue is a critical part of the dressage horse, and the tongue via the hyoid apparatus is attached to the TMJ, is attached to the pole, or C1 is attached to the sternum, actually his inner ear I forgot about for balance, his sternum and his scapulas. So there's a hyoid apparatus in here that it starts at the base of the tongue. It connects the base of the tongue and then works its way back. So that's an area that I actually like to just double check too, because I ask people how the horse is doing with the bit. It's very important that the horse give in the jaw in the training and lick and chew. So we ask them to flex. So I would like to point out also the glands that are here. In some horses, these glands are a little bit oversized, and you can see them bulging on some horses. And that actually makes it hard for them to flex and give in the jaw because it's so big and it gets very tight and tense. So that's another area that you can lightly massage to help them out. You can see he actually enjoys all body work. So the whole head with the tongue, the TMJ, the jaw, this gland, all this has to release. I don't have a bit in his mouth. And the licking and the chewing, you'll see a lot of horses salivating, which is really important, which the glands do. So it's just super important that they be very supple and soft and relaxed in this part of their heads. Okay, so I'm just pointing out different things. Now the next thing would be the nuchal ligament. I'd like to sort of bring up. The nuchal ligament is in here, and you want it nice and soft and supple for dressage horse because we're actually asking them to really stretch that nuchal ligament and for them to come round and on the bit. So for horses that some horses have crestier necks, and this is longer than under here. That makes it a little bit easier for the horse to round up when the top line of the neck, the nuchal ligament, is longer than the bottom line of the neck. But sometimes you run into horses that are more even, the length of the necks, and when that happens, they definitely can be tight in the nuchal ligament. So that's a very important area to work on. Now moving back here to the scapulas, the shoulders, which are independent from the torso of the horse, as they go up the levels, they want more and more extension. So these triceps right here get super duper sore in a lot of horses, especially young horses that are just starting to learn to lengthen. I have a 5-year-old, and right now she's starting to lengthen her trot steps, and she's got super sore triceps right here. So I have to be super careful because if I just touch them like that, she threatens to kick. That's how sore she gets. So this can be an area for sure. It gets really, really sore. Okay, so another area we want to look at are the withers and these trapezius muscles that are up here. A lot of horses are what we call tight in the withers, And a lot of trainers will say to the riders, we need to soften the horse up at the base of the neck or at the withers. And then we'll do super flexing left, super flexion right, back and forth a few times to try to loosen up this muscle. So this muscle can get sore. See, he's up here. And as you can see, it kind of attaches to the top of the scapula too. So, and there's a lot of movement in through here. So that, he's already licking and chewing from me massaging that a little bit. So I find when I do the neuromyofascial release that a lot of times this is out just here in the thoracics at the wither area only. Often I get back here where the saddle is and it's fine, but this can be out, and so it's very important that this get massaged to be nice and loosened up. And if they do get aligned there, it's going to stay better, and it's a tough area. See, I haven't done this in a while, so as you can see, he's relaxing. So, okay, so then moving further back, we have the longissimus dorsi muscle here, which is kind of where the rider's sitting, and that too, as the horse rounds up in dressage, the back should come up, and this should actually get stretched up to the rider's seat. So this is a really important muscle, and what I find, if they're well trained and they're super muscled up, they're generally not that sore there, but they can be very tight depending on where they are with the workload. So, so that obviously is a good place. Now, moving on to the rib cage. I want to talk a little bit about the rib cage because it's a super important part of dressage riding, the rib cage. What will happen, and I'm going to show you, let's take a minute and look at, we have a big one here, sorry. Let's take a minute and let's look at this diagram. All right, so in the diagram that you just looked at, you're going to see that the actual thoracic part of their back can actually flex and bend in the spine. So, and that's the kind of, when we ride a horse in dressage and do all of our circle work or our half pass work where they're crossing, the horse is bent through the back. The ribs are all attached to each thoracic, each rib. So the rib cage has to have some flexibility too. So it's really important to massage the rib cage. I can't tell you how many sore rib cages I work on dressage horses. Now, I want to point out something else with the rib cage, and that is in the training, you may find that usually, not always, but usually the right rib cage is more sore than the left side, and there's a reason for that. Horses are not born symmetrical, and so they tend to lean to the right in general. There's a couple reasons for all that, but because they, quote, bulge on that right side, they lean on it, they get tight there, and they're not supple enough in that right rib cage. So we find ourselves when we train, especially young green horses, young or green, is that we have to use a lot of right leg to get them to come over, stop leaning on the right side, move their bodies over to the left, engage the left hind to carry the weight so that they can give on the right side. So I just worked on a big giant dressage horse a few weeks ago that was so sore down his whole right side they couldn't even get a right lead canter out of the horse anymore. And this was like a 9-year-old dressage horse. So I went in and worked on him, and I literally spent a lot of time on the right side in the rib cage because I could just put my hand there and he was falling apart. So it didn't take much. So I had to really work down his whole right side because he was evidently just leaning too much. They were kicking the heck out of him on that right side, and his poor rib cage was so sore. It was terrible. So anyways, so because horses tend to lean, we have to push them up over, so there's a little more action with the rider with the right leg than the left on the rib cage. So that can get sore in of itself. So rib cages are super important because they help with the flexible lateral flexion of the horse's body, and they have to be movable because the spine is moving. So I just wanted to bring that up. So now we're going to move further back here, and that's right. Okay, the gluteus muscle. Okay, these are the gluteus muscles back here. Obviously, this is the engine of the horse. These gluteus muscles can get very sore and tight. I've worked on a lot of horses where they've actually strained a muscle back here. So if I can actually pinpoint exactly where the muscle is, see, he's even licking and chewing just me doing this a little bit. If I can pinpoint exactly where the muscle is and it's really, really sore, I'll do the kinesiology taping too. Because that's a really good way to support the blood flow and the healing of the strained, sometimes even torn muscles in the hind end. So this is a common area. Sometimes the muscles here can be sore. It depends on the horse. Obviously any muscle can be sore because dressage horses work very hard, and they're a little bit like bodybuilders. The riders are always trying to put more muscle on their horses. So those are the sort of the common areas that I see that I work on a lot, and I just wanted to bring this to your attention. If you have any questions, certainly feel free to drop me an email. I'm Liz at provenequine.com, Proven equine.com, if you have any questions. And enjoy your massage work on dressage horses.